So as we can see, these two are typical ribs, and a typical rib, it consists of the sternal end, a vertebral end, and an intervening shaft. The 3rd to 9th ribs are typical ribs. So this is a typical rib, and this is the sternal end. It is obliquely placed, as you can see, and the sternal end is at a lower level than the vertebral end. Okay, and it bears a, if you can see, a concave, see here, it bears a concave depression to receive its own costal cartilage. Now this is the vertebral end. The vertebral end includes the, you can see, the head, the neck, and a tubercle. So this is the vertebral end. The head, if you note carefully, it has two facets which are separated by a crest. The lower facet is larger than the upper one. This lower facet, it articulates with the body of numerically corresponding vertebra. Means the lower facet of the 3rd rib will articulate with the 3rd thoracic vertebra, or the body of the 3rd thoracic vertebra. Okay, and the upper facet is smaller one, articulating with the body of the adjacent upper vertebra. If this was the upper facet of the 3rd rib, then it will articulate with the body of the 2nd thoracic vertebra. And if you can see the crest here, note the crest here, this, it is connected to the intervertebral disc by interarticular ligament. Now the peripheral margin of the head, it gives attachment to the capsular ligament of the synovial costovertebral joint, and the anterior margin to the radiate ligament. So now coming to the neck. So this is the neck. This is flat. The neck is flat, and it extends posterolaterally from the head to the tubercle. Now if we see the anterior surface of the, if we see the anterior surface of the neck, we can see a ridge. Can we see a ridge? Yes. And this ridge divides the anterior surface into an upper small and a lower large area. And this ridge gives attachment to the posterior intercostal membrane of the upper space, and this is continuous with the inner lip of the upper border of the shaft. Okay, inner lip of the upper border of the shaft. This lower area, this is related to the, or covered by the costal pleura and intervening endothoracic fascia. Now if you see the posterior surface, you can note that it is rough, and this is connected to the transverse process of the corresponding vertebra by costotransverse ligament. Now here you can see in the upper border of the neck there is a crest. This is also known as the crista coli. This gives attachment to the superior costotransverse ligament extending from the transverse process of the upper vertebra to this crista coli. Okay. Now if you note, this is the lower border of the neck, and you can see that it is rounded and continuous laterally with the upper lip of the costal groove. It gives attachment, this area, to the posterior intercostal membrane of the lower space. This is the tubercle, the next feature. The tubercle is a backward elevation at the junction of the neck and the shaft. And if we see, it has a medial articular part and a lateral non-articular part. This is the non-articular part, and this medially is the articular part. Now this articular part, as you can see, contains an oval facet. Okay, this oval facet, it articulates with the costal facet on the transverse process of the corresponding vertebra and forms a synovial costotransverse joint. And this non-articular part, it is connected to the tip of the transverse process of the same vertebra by the lateral costotransverse ligament. And in the upper 6 ribs, the articular facets are convex, directed backward and medially. The facets on the transverse processes are reciprocally curved, but for the 8th to 10th ribs, facets are flat. Okay, for 8th to 10th ribs, these facets are flat and face backward, downward and medially. The costotransverse joints of the upper 6 ribs permit rotatory movements, whereas in the succeeding 3 ribs they allow gliding movement. Now coming to the shaft, you can see the shaft here. The shaft of a typical rib is thin, flat and curved. From the tubercle, as we can see, from the tubercle it passes backward and laterally and then swings rather abruptly forward. Now this site of this change of direction is called the angle of the rib or the posterior angle, where it is both curved and twisted. The angle here is the weakest part of the rib. The backward slope of the rib passes beyond the thoracic spine and forms the most posterior part of the thoracic cage. Now the shaft presents internal surface, external surface, upper border and lower border. So the external surface, we can see it is convex. Presents a, if we see the area between the tubercle to the posterior angle, it presents a rough line that slopes downwards laterally, and here it gives attachment to the posterior layer of the thoracolumbar fascia and iliocostalis thoracis. the distance between tubercle and the posterior angle, it keeps increasing from the 2nd to 10th rib, where it is 5 centimeter. And this area gives attachment to the levator costae, overlapped by the erector spinae muscles, this area. Then close to the sternal area, so you see this is the sternal area, and close to the sternal area there is a rough, if we can see here, a faint, can you see? This is the faint oblique line. Here also there is a change in direction of the rib towards the sternal end. This is called the anterior angle, and this separates the attachment of the external oblique in front from the serratus anterior behind in the upper 8 ribs, or from the latissimus dorsi in the lower 3 or 4 ribs. Now the inner surface. This inner surface is concave and smooth. You can see that. And in the upper, there is an large upper smooth part which is covered by the costal pleura and separated by endothoracic fascia. If we see the lower part, there is a costal groove. You can see the costal groove. And here lies the intercostal vessels and nerve. Now, if we note the costal groove, it has one upper border and a lower border, or lower lip, upper lip, lower lip. Now the upper lip, it is continuous behind with the lower border of the neck, and anteriorly it extends in front to the junction of the middle and anterior third of the shaft. Middle to anterior third of the shaft. The lower lip of the groove, it actually forms the border or lower border of the shaft. Now this upper lip of the costal groove, it provides attachment to the, or provides origin to the intercostalis intimus muscle, and the floor of the concave floor of the costal groove, it gives origin to the intercostalis internus. The space between the intercostalis intimus and the internus muscles form the neurovascular plane, and in a typical intercostal space, it is traversed by the intercostal vein, artery and nerve from above downwards. Now the upper border of the shaft. The upper border of the shaft is broad and rounded in the posterior part, and it presents outer lip and inner lip. The outer lip, it receives insertion of the intercostalis externus of the upper space. The inner lip, okay, the inner lip, it provides attachment of the inner lip provides attachment of the conjoint attachment of the intercostalis internus and intimus muscles. Now we already noted that the lower border of the shaft is thin and sharp, and this gives origin to the intercostalis externus of the lower intercostal space. Coming to the ossification of the ribs, a typical rib is ossified from one primary center, that is for the shaft, and it lies near the posterior angle, here near the posterior angle, and it appears at about the 2nd month of the intrauterine life. And there are 3 secondary centers, one for the head and 2 for the tubercle, one for the articular part and the other for the non-articular part. The secondary centers appear at about puberty. They fuse with the rest of the bone after 20 years. And this method of ossification is applicable to all the ribs except the first and the last two ribs.